Good morning. It's Wednesday. So, it must be Woke Women Wednesday. Senator Dianne Wilkerson with you here. My guest actually is going to be getting on in a second. She's in her car. So, let me just take this time to say hello. What a beautiful, beautiful day out. I want to really say what I always say at the beginning of our time together. I'm even more thankful today than I normally am for the women with the vision, the women who knew how important it was, the women from Woke Women Media, the women from WWOCmedia.com, WWOC Radio. 2 years ago in May of 2020, happened to coincide. They were planning already, but it just happened to coincide with the onset of the pandemic. Now we're in a new one, apparently, the monkeypox. I'll talk about that a little bit at the end because it actually has come to Massachusetts. But we really are privileged to have the time every Wednesday to come and talk to you about all things Black, Brown, and COVID, which means everything. So, to the women with the vision, I thank you. At 11 a.m. on Wednesday mornings, I have it's a distinct privilege to me to be able to have this medium to share vital information with you. And at 8 p.m. on Wednesdays, my fierce and fearless city council warrior, co-host, colleague, city council Julie Mejia, she closes it out. So I come at 11 and she closes at 8. And we always try to bring information to you that is helpful as Black and Brown people living in and around the great city of Boston. And so this morning, when she gets on, we had her on for a minute and couldn't get her on the screen. So hopefully she'll be back. We're going to talk a little bit about this, like, so the sister epidemic. Not enough conversation, but the sister epidemic, substance abuse and opioid addiction, which just absolutely went through the roof in the last 2 years. And no surprise to most of you, I suspect that the communities are handling it in very different ways. So let me get my guest on. There she is. She is on. We're on. We're on. I actually just started to did my welcome so I could say good morning to everybody. They're already here, and just giving you the. I was actually giving you the. Can you hear me?
I can hear you. Can you hear me?
Perfect. I was actually just
Yay.
doing giving the outline and getting ready to do the introduction to you. I was just saying that so much has happened. WWOC Radio provides a medium every week for us to bring timely information to our folks, Black and Brown folks in and around the greater Boston area. Although you can listen from all over in anywhere, and we do. We have so many people who are listening in that they don't watch you in this 30 minutes. I tell folks always get you a cup of tea or a glass of wine, depending on your preference, on Friday night or Saturday, and cuddle up and get comfortable and always know that you're going to leave with some important information. So Leah Randolph is here this morning. She is such like I say, a main spoke in the day-to-day operation and continued operation of the community that we call Boston, Greater Boston, but a national presence as well. Very quietly and sometimes not so quietly, just last week came off an incredible 3-day conference, really designed to educate people about what substance abuse and addiction, and really targeting Black and Latino people in this in the state. Like I said, but she's a sought after mind across the country, co-founder of the Commonwealth Mental Health and Awareness. And you can talk a little bit about that, but it's the Massachusetts Black Alcohol and Addiction Council that really prompted my invitation to you, because I was absolutely struck. I think of myself as kind of learned and knowledgeable about the subject of substance abuse and addiction, but not anywhere near as much as you, as deeply as you. And COVID has taken so much of our lives behind closed doors, but there's a part of this that happened during that time that I really want you to talk about. So I'm going to shut up, introduce Leah Randolph to you. I thank you. I know that, like always, you're dealing with some family issues, but you chose to be here this morning. I appreciate it, Leah Randolph, and
Thank,
welcome to Woke
thank you.
Women Wednesday.
Thank you so much for having me, Senator. This is important to not just to me. Once the reason we held the mini BAI, which is it's supposed to be a small version of the Black Alcohol and Addictions Institute, which began, excuse me, 40 years ago, and the institute ran for 7 days, and we coupled with a historic Black college or university. So it was either with Morehouse School of Medicine or Cork Institute at Morehouse University, or at another Black university. And so now we were blessed to be able to um, to partner with the Black College in Massachusetts,
With our
the
own, right?
historic Black college in Massachusetts, recently named historic Black college, is Roxbury Community College, under the directorship of President Jackie Jenkins Scott, who has just done some amazing things in the short amount of time
Short time. She's
been
been
there.
here, actually a guest for us about 6-8 weeks ago when she was just for, and she laid out her vision, and I'm watching her execute in rapid speed.
Absolutely, absolutely. So the area that we used was all brand new, really recently refurbished, had all of the electronic equipment. It was our first time doing a hybrid model, so the Addiction Institute is really designed to look at addiction, and the impact it has on Black folks across the country. And the mini BAIs, this is our fourth one in probably over 10 years, that focuses on the people in Massachusetts. And so because of COVID, because of the increased number of Black people that have been dying in the Commonwealth of Massachusetts, this is one of the smallest states in the country. And what really brought the alarm down for us was that specifically Black people are in this state are number 4 in the country for the highest number of deaths that we have had that are related to substance use disorder. And so, that's fentanyl, that's alcohol, that's crack cocaine, that's heroin, and all of those things. So what's happened in our community? So what's
So
happened
can
is
I
that.
can I just stop you there? Because two
Mhm.
things I want to just make sure that I tell the folks who are watching and listening, always, when you come to WWOC to Woke Women Wednesday, you should always have a piece of paper and a pencil, because you're going to hear something, you're going to get some information that you're going to want to write down. And then the second is to repeat what you said, because those numbers, when I talk to people in my promo about numbers, I said you're going to want to hear what she has to say. 50 states in the nation. Massachusetts is fourth, with me in the top 5 in Black fatalities,
That's right.
deaths from opioid, alcohol, heroin, substance abuse, addiction.
Right.
So fourth, people, fourth.
Without one Black owned and operated treatment facility in the entire Commonwealth of Massachusetts.
Let me say that again too.
There's not one. Different agencies have taken over, contracts for the Black, and specifically Black culturally competent programs that we had back in the 90s and 2000 up until 2008. But they changed the direction of those contracts based on the opioid epidemic among young white abusers and users, and so people who are addicted, and so we created a trust issue, and Black people stopped accessing treatment. So there's no engagement, and so those numbers are really high too. Is that they're trying to figure out, how do we engage this population? How do we engage this community? Well, if you're from the community, and we are, then you already know that it's going to be very challenging once you've been, abused, once you've been neglected, and once you've been put.
Uh-oh. We lost her for a minute. I'm hoping. Oh, there she is. I'm going to say. And if you black out, we lost you for a minute, Leah. And if we lose you again, just click back on. You can come back on, but we'll keep talking. Just, folks, listen to what she's saying. Listen to what she's saying. Fourth in the nation, and yet we are completely ill-equipped to respond to it, because there is not one single Black-owned, Black-controlled, Black-directed facility in the state of Massachusetts, in the entire state, to address, culturally competent to address what is happening to our people. In any other place, in any other time, in any other moment, the alarm bells would be ringing and sounding off, but they somehow don't sound when the people who are harmed are Black and Latino folks. This is so important because we focus so much of our last 2-year conversation on the perils and the evils and the losses during COVID. But one of the things that happened during COVID is that isolation. People didn't get to see each other, is that people were in their respective homes, walls, shelters, hospitals, if they were fortunate, tents where they were living, self-medicating in ways that are disproportionately fatal to and for Black people. Fatal. There's no other way around it. And the other thing that she said, and I said, we lost the connection. I hope she'll be back. And this is the benefit that I get from talking to her, so I can keep the conversation going. The other thing that she shared was that between the mid 90s and up to 2008, we actually had six facilities, 6 programs that were specifically focused and targeted to Black residents in Massachusetts. And in fact, we had it in Western Mass, Central Mass, and of course in Boston. The legacy is real about the programs that were operated by, I say, Brother Kinney, First Incorporated, all born from the genius, the mastermind, the late Nat Eskia, the Eskia family. We talk about, but not nearly enough to talk about that history, that mind that led to the creation of First Incorporated, and the need is greater now than it ever was, and we don't have one. We don't have one. How is that even possible? Let me see if I get Ms. Randolph back. Okay, you're back.
I'm back. Yep, I'm on another phone.
It's a little cloudy, Sal, but I can still hear you fine. As I said, one of the benefits of talking to you is that I can speak to it when I can't see you, and when we can't see you. So I was sharing with them, just to reiterate what you said, is that from the early 90s till 2008, we actually had 6 programs that were not only kind of Boston focused, but statewide focused. And part of it grew from the genius and the legend of the late Nat Eskia, First Incorporated, Women's Inc., and that your involvement in those programs were culturally competent. And we struggled then. I don't want people to think that meant it was a cakewalk. It was a struggle, but we were there and we were able to make that case. How in the world in 2022 we end up with absolutely nothing and not one is a story to be told at some point, and we'll tell it. But today I really want you to talk about the state of the case, like what's going on and what it is we need to do, because I know that you're in it. I also want you to think you can talk a little bit about, what's going on in, this whole mass and cast. This has now become a whole thing in and of itself. What's happening in Nubian Square, what's happening in our surrounding neighborhoods, all the neighborhoods that surround it. who are the people that need our help, and to remind us again what that help is around a healthcare crisis and not a criminal crisis.
Exactly. The good news is that part of that was the reason part that we held the conference, is that we were training people, educating people, and highlighting the issues that are prevalent in our communities across the state. Also, we were able to garner partnerships and allies with the Bureau of Substance Abuse Services, with RISE, with MORE, with Boston Public Health Commission, Office of Recovery Services. And the thing about it with these people that are directing and heading these agencies right now, is that they are honest, and they are saying that they're not pretending that they understand how to be able to address this issue, and they are
That's so
talking with
important.
us, and they're working with us, and they're providing the resources that we need to be able to move forward. So this is that's a really important, something really important that we have to make sure that everybody knows. Now, second is that in our communities, there's so much denial around the fact that these issues do exist. So
Still,
we have people who have been using drugs for years, and they put themselves on their own maintenance program, and they were using heroin, and they had it figured out how much they were going to use, every day, and it was their management program. But because they are now lacing everything with fentanyl, these people are losing their lives. We also have elders who have been on, let's say, pain medication for several years, and then as this opiate epidemic heightened, then they started taking them off of the pain medication, and so the only thing that they could do is that they became the prey of the street dealers, and some of them even sold their pain medication because they developed a tolerance for the pain medication. So
it wasn't affecting, giving them the kind of high
listen,
or whatever.
people don't
Yeah.
even know their parents are having these problems. When I was working at Boston Medical Center before we started our clinic, about 10 years ago or 8 years ago, I saw many patients who came in like towards the end of the month that were 65 years and older, because they had run out of their pain medication. Because of the tolerance, they needed more additional pain medication instead of being weaned off the medication or looking at alternative ways of being able to help them with back pain and different pains. And there was this woman who was 71 years old, and I said to her, the withdrawal symptoms that you're having right now don't make sense to me for the pain medication that you're taking. So I really need you to trust me and be honest with me. And she started to cry and said, please don't tell my daughter, but I have been using heroin to supplement my pain medication. So I sell a portion of my pain medication to the boys on the block.
Wow.
They give me heroin, and so I make a little bit of money. I get enough heroin to be able to make it through the end of the month, and her family knew nothing about it. So folks, you have to pay attention to what's happening to our elders and to our parents and our aunties and our uncles and all of those folks,
Right.
because they're really hurting. And so this has to do with systemic racism, because there are doctors now that are really talking to this issue around how Black folks have been used for years, in the medical industry. And that they when we walk into a hospital or we walk into a doctor's office, they automatically put us on another scale, not a scale that they use for Anglo-Saxons, white folks, Asian folks, a scale that is specifically designed for Black people. And what it looks at is how strong they think that we are to be able to manage pain.
Right.
And so they don't give us the medication that we need because of that. And then the other piece is that since we've been on medication, they just have been taking people off medication. And I mean, it's so inhumane what is happening to the people in our community. And we really have to start making some noise. We really need to start asking some more questions. And if you listen to a pod, you could actually go on YouTube and listen to Dr. David Williams. He's over at Harvard University, and he talks about, how Black people are being used and have been used within the systems. But he also talks to what we can do and what questions that we can ask when we go into the doctor. I mean, even in terms of our creatinine levels for our kidneys, we are on a whole different scale that they use specifically for Black people, and they know it and they say it, and so these are questions that we have to make sure that we're asking when we go to our doctors. What scale are you basing your prognosis or diagnosis on me? And because because I'm a Black person, but I may have a whole bunch of other stuff mixed up in here, with who I am. You can't do that to a human being, but the medical industry does. So definitely listen to Dr. David Williams, because he will provide insight for
Let
that.
me just grab my pen. I just said that. I grabbed my own pen. Hold on a sec. Because I want to make sure I write that down because I'm going to watch it. One of the things that you said, talking about just presenting, in medical spaces, and especially doing it in 2022, after so many of us were literally in hibernation for 2 years. And when people are in hibernation and they're in pain, they get creative like everybody else, and they find ways to self-medicate. And that's the real myth, or not myth, misunderstanding or refusal to understand that if I'm in pain and I'm really in pain and I come to you and I say to you, I'm in pain, and you don't give me what I need, I'm not going to walk out and go home. I'm going to go someplace else to get something. And that something is killing us. And I was fortunate to see a presentation 3 months ago by our incredible executive director of Boston Public Health Commission, Dr. Basola Ojikutu. She did a presentation on what's happening, around opiate addiction in our community. And she said a lot, but one of the things she said that I registered and stuck with me is with respect to Black men, that the increase in fatalities from opiate overdose is increased, as you said, 278% in over a 3-year period. Now, I don't know anything other than inflation. I don't know any other thing ever measured that's had that kind of an increase, a negative increase in a 3-year period than that. That again ought to have the alarm bells, sounding on the hour, every hour. But somehow we're just moving on along, and this you couple with the fact that we lost more people to COVID fatalities, more Black people. We were, from day one, we're 24% of the population of the city of Boston. We have never been less, not 1 week in 2 years since April of 2020. Not 1 week have we been less than 32% of the deaths. We're 24% of the population in the city of Boston. We're the only group of people that have consistently died of COVID in numbers higher than our very presence in the city population. And so now you attach that to what's happening with opioid addiction, and then, like you say, people out on the street. At some point, you can't walk around paranoid all the time, Leah, but at some point you gotta stop thinking it all just happens to be happening right at the same time. So that when our folks are out there, they're buying stuff that's laced with all kinds of poison. And it is that fentanyl, like you said, that is killing people dead, killing them, our people. So what you're doing is so important. And I do want you to kind of harp back on the issue of what to do. What do? We walk around, we hear, We want to be supportive. We want to go to Nubian Square. We want to be helpful. I know there's some programs there that are struggling, but there's some things that are working. If you could speak on that.
Sure. So I recently joined a few months ago the Nubian Square Task Force, and that's a combination of different community-based organizations. The stronghold on helping to reinvigorate the community is the Brothers from the Nation of Islam, and
No surprise.
yep, it's called Torchlight. And Torchlight, they have been down there just volunteering their services until finally they did get funding from the Boston Public Health Commission. Again, Jennifer Tracy, who just, she is a warrior, and she understands, what it is needed. But the funding has run out, and so we're seeing, the people coming back into the community. We're seeing them walking around. I was down there yesterday, and one, there's no treatment programs for them to go to. So where else are they gonna go? And they're there back in the streets. And until we get funding for Torchlight, which is really important, until we get funding for the brothers and the sisters who are down there doing the work, because not everybody wants to do it, and not everybody can do it. We have to have compassion and love for our people and for ourselves in order to be able to help somebody else. And so people who are addicted are human beings. They, like I said earlier, that's our family, and they can tell immediately whether somebody is sincere about wanting to help them. We're also seeing the numbers for HIV have doubled in the last 2 years, and people are not aware that that's what's happening. We're also seeing the Hep C. The numbers are skyrocketing. People are sharing pipes and things like that, and so that's how
If you
they're
doubt that for one
infected.
minute, all you have to do is be sitting at a light on Melnea
Right,
Gas or sitting at a light on Mass Avenue, and you'll
right,
see it for yourself.
exactly. So it's going to take a lot of people power
I'm not
to.
ignoring you. I'm writing while you're
Yep,
talking.
I understand. It's going to take a lot of people power for us to really go in and have a culturally competent model that will help, us to engage with our people in their homes. We're going to have to go into the homes. We have to go into the neighborhoods, and that is not something that anybody can do. So we have to have a model that comes from within the community to address the issues of the community. That has to be from your neighbor who you trust is not going to turn you into the police or call DCF on you or something like that, who may have the job now and have been trained in not a Eurocentric model, but an Afrocentric model in how you're engaging with your neighbors and helping them to understand the importance of getting some support, getting some help. The other thing that we're doing is, we're working on doing is being able to train those folks that are running the programs right now on understanding from the top down what cultural competency is, because the treatment cannot be worse than the addiction. And
That's right.
that's what happens, is that we go into treatment and we're treated poorly. We're put on the back burner because we're not the face of addiction right now. And we're the same face that they have been using as for a criminal, you know, criminal actions taken against people who are addicts that happen to be people of color, versus being empathetic and looking at it as a medical model, which it is. And so until we as a community are open to hearing the information that I'm sharing with you right now, and are take off our blinders, and pay attention to what is going on, and have conversations, and know that we will be out with literature and material that we'll be sharing with our community. We're planning on doing something on opiate overdose week. I think that comes either the end of July, the beginning of August. So we're going to have a really huge event in Nubian Square. we're looking to partner with whoever wants to be a part of that conversation with us, and making sure that we inundate the communities in Boston and across the Commonwealth that are the most impacted with information. Do you the problem? Another problem is that many Black people are not accepting Narcan, and so when you're using fentanyl, the supersonic doses of Narcan that they have out now could save somebody's life, and people are not accepting it. There's different ways that we can get it. You can go to your pharmacy. If you have insurance, if you're on Mass Health, you don't pay any copay. Go to your pharmacy and say, I need Narcan. Maybe it's not for you, but it might be for cousin Pookie or whoever it is that just to have it, because people in your neighborhood are using, and you could walk up and see someone overdosing, turning blue one day, and you have that Narcan kit on you. So it's really important that we're looking at prevention, we're looking at intervention, we're looking at engagement and training and
Right.
outreach. It's a huge initiative, and that's why we invited you, Senator Wilkerson, to be a part of the conversation, because you have one of those great minds. You're a strategic planner. And during the time that you were in office, we had treatment programs here in the Commonwealth of Massachusetts, both in Boston, in Worcester, in Springfield, that were culturally specific. And so, people are playing these games around politics and not wanting to, come into the job with not having any information and not wanting to learn. This is not right now. People are dying at an amazing amount. Of the cost to our community is tremendous. This is not a time for us to be learning, what we should already know. So, it is important, and that's why I'm supporting you, because I know that you understand how we need to move forward, and you're fearless and not afraid to be able
Yeah.
to speak to that.
Yeah. So, and I appreciate that. And it's so much to process, and it doesn't have to be, because the reality is that we have, like everybody else, we have a deep level of knowledge and expertise in our communities, of people like yourself who have provided the resources and given that space, can actually address this issue that we're scratching our heads and wringing our hands over every day. But there's something about that simple thought of giving people who know what they're doing the resources to do it that has got people all confused. And so for me, my passion around this comes from, part of it's anger, part of it is my, just what I see, right? And this is one of the things I talk about often, Leah, and you said it in a different way, that we know for fact that the responses to this issue, which is a universal issue, but the responses to this issue could not be more different. We have created this notion because we see them, the tears, the crying moms, the white suburban moms on our 5 and 6 o'clock news, talking about how they lost their children and how terrible that it is, right? And it is terrible. There's no question. But the reality is that Minnie, Bubba's mom, she's not on the news crying about having lost her son. She's in community meetings saying that the Fed bus came and took her son, who had the same issue, right? Like, one community gets family van medical services kind of parked in their city square, and the other one gets the Fed bus parked in their city square for the exact same issue. The Fed bus. The Fed bus just 2 years ago. Did you remember the major bust in Lenox and bragging? Press release. We rounded up 17 people. Yeah, okay. They didn't take them to the hospital. They didn't take them to treatment. right? That's not where the 02119 bus goes when they
Right.
leave. And
Right.
that's the frustrating part and the infuriating part for me. So I yell that from the highest mountain. And when you point that out, people can't defend it. So then they got to act. But you know
Right.
what? Somebody's got to be pointing it out. And the
Exactly.
fact that you could speak to the kind of numbers and the pain and the loss and the death that you are telling us about that's happening within feet, within a quarter mile, within yards of where you and I are both sitting, and there not have been a single public statement, press release from those charged with the responsibility of being public officials is to me all part of the problem,
Right.
because people are begging for help. The parents are crying for help. Like you said, if you're a mom who has a child, or you're a mom or a dad who has an addiction issue, where do you even go? Like you said, where do you go? And if you can't find Dr., find Leah Randolph and the kind of, like, where do you go?
Right.
And that is the question that we are duty bound to answer. And I know that that is something that you're spending, your time on. I appreciate that. I just, and it's any other final thoughts that you have before we go about this issue and what needs to be done, what we can do.
Yeah, so our response was that, we opened a clinic. So we have an outpatient clinic. David Avery, my business partner, and I opened our clinic about 8 years ago, Commonwealth Mental Health and Wellness Center. And so we
Woo!
address mental health, we address the wellness of our people, and we look at alternative ways of helping people to heal. Everybody doesn't heal the same way. Everybody doesn't, everybody doesn't live the same way. Everybody doesn't think the same way. And so we have to have, a numerous ways to be able to help guide people to wellness. And so that's something that we do at our program at 895 Blue Hill Avenue in Dorchester. And we also opened a second program during COVID in Lynn, Mass, and still addressing the same issues of mental health and substance abuse and the disparities that the communities of color are experiencing. And so, talk to your legislators, watch the video from Dr. Williams. And also there's a sister, her name is Dorothy Roberts. She is also on TED Talks, and she's an attorney, but she speaks specifically to the issues that Dr. Roberts speaks to. And I think it's education for all of us to be able to pay attention to this. There's not a conspiracy theory, it's an education. We have very gifted doctors that are working with us. I call them our dream team, who are advising us. And one of them is actually, working now with the Boston Public Health Commission, which is a great thing, because he gets it, he understands. He's a psychiatrist, and Dr. Isom and Dr. Brathwaite are two female psychiatrists that are in our community and are really working towards change. They understand the importance of how we look at how people are being treated. And Dr. Simon definitely gets it. He works with adults and children. So there are those resources. There is a van that the Boston Public Health Commission has in Nubian Square, where they're going to be testing. They're going to be testing drugs, so that if people bring like just the bag or something that those drugs were in, they can test those drugs and tell you what is in it. So I mean, if it's about harm reduction to help to save lives until we can get to a place
Right,
where we can
right.
get people to stop, to understand that, to feel confident that they can be well, then until we get there, then we have to choose whichever route it is that we're going to help them to get to the next day, to be alive the next day. So it's speaking truth to power, talking to your legislators. Look at our MBAC website, and so we have it up still from the conference, because we've got a lot of information on that website. It's mini BAI conference.com, and you can go to that website and learn some of what we're talking about in terms of cultural competency, and that and just be on the lookout for the information that we'll be continuing to share in the community. Trust your gut and know that we can stop this. This is a pandemic.
We can do it, and we're going to do it. I thank you, Leah. So again, minibaiconference.com. Go on and look on. And she mentioned the dream team. I think do a whole another 30 minutes on that when we're going to go. But you talking about some really badass professionals and, parents, adults, social workers, teachers looking for some answers. You need to connect with those folks, and the answers, the questions that they were able to answer, the information that you shared today, priceless. And this is one of those sessions of Woke Women Wednesday that I'm sure we'll replay, right? Because people need to hear it. And I'm going to have you back as we get deeper into the summer, I think into the fall, and the planning for the return, hopefully to return to school, because clearly, we're in recovery mode. All that means is really we're telling people to go back and pretend that things were the way they used to be. Well, first, the way they used to be wasn't good for us to begin with. And second, it's worse.
Right.
It's worse. Right. And it's people like you that help make it better. So, folks, you heard it. Woke Women Wednesday. Leah Randolph just dropping the knowledge I told you she would. All kinds of information. I hope you would go on the podcast, YouTube, TED Talk, and listen to David Williams, listen to Attorney Dorothy Roberts, because they talk about things that are important for us. Leah, you promised to come back.
I promise to come back.
Woke Women Wednesday, signing off in our morning. And remember, my colleague, City Councilor Julia Mejia, will be here at 8 p.m., always dropping knowledge. Until next week, we'll see you. Stay safe, folks. I know we're sick and tired of talking about pandemic and COVID, but unfortunately, COVID ain't done with us. So continue to wear your mask when you're in large crowds of people. Please wear those masks, because the infections have not subsided. In fact, for us in our community, they have been surging. And now we have yet another contact transmitted concern to worry about with monkeypox. We now have cases in Massachusetts. So just be careful. Be careful. Use your common sense. Get your kids in that mindset, as they want to be out in the summer. We know they do. But stay safe. Wear your mask and stay safe. We'll see you next week. Woke Women Wednesday. We're out.
Thank you.